Welcome back to part 5. We're going to begin here with drug development. Pharmaceutical companies will be conducting research studies to propose new drugs to the FDA for approval. Initial testing in lab animals will be part of the first stages, and then it moves along different phases, and then in phase 4, you have the FDA review for approval. In this class, we're going to be looking at medications that are based on their classifications. So a classification is a grouping of drugs based on their effect. Here you can see the classification or the class of the medication is an aminoglycoside. This is an antibiotic. Its effect is antimicrobial. Another example here would be a beta blocker. A beta blocker is an antihypertensive medication. With each of the classifications, you're going to have a prototype. A prototype is a drug that represents the classification. It is usually the first drug to be developed in the class, and it is the standard for which newer drugs are compared. Newer generations will evolve over time, but the mechanism of action is going to be the same. When we learn our classifications of medications in this course, you will be asked to know the prototype of that class of medication. So looking at the nomenclature of medications, we have 3 names: the chemical name, the generic name, and the brand name. A little bit more detail here about these 3 different names. Your chemical names are not going to be used by healthcare providers. Those chemical names describe the chemical structure of the drug. It is irrelevant to healthcare practitioners and patients. We do not need to know the drug structure. We need to know the generic names and the brand names. A medication is always known by the generic name. A generic name is typically going to be seen in parentheses, and it will not be capitalized. Sometimes these medications are going to be hard to say. Over time, practicing saying these medications will help you. A brand name is a medication or a name that is given to a medication by a drug company that markets it, right? So if more than one drug company markets a particular drug, it will have a different name for each one of those companies that is marketing it. This is the name that you're going to see that is capitalized. In this course, you need to know the generic name of medications. You will be tested in this course and your other courses based on the generic name of medications. You will also only be using the generic name on the NCLEX RN exam. So it is very important that you learn these generic names. So take a look at these 4 medications here. We have Advil, ibuprofen, which is 200 milligrams, ibuprofen 200 milligrams, Motrin, ibuprofen 200 milligrams, and Nuprin, ibuprofen 200 milligrams. What do you think is true? Which is the correct answer? They all contain the same drug? People with muscle pain should only take Motrin? Motrin is the generic name. Nuprin is only for headaches. A is the correct answer. They all contain the same drug. They all contain ibuprofen. People with muscle pain should not only just take Motrin. There are other medications that can be taken for muscle pain. Motrin is the generic name. That is false. Motrin is the brand name. And Nuprin is not only for headaches. So the correct answer here is A. They all contain the same drug. This is important to note for patients as well, because they may think Motrin and Advil are 2 different medications and be taking them for something different, but they are essentially taking the same medication. So think about what this could lead to. This could lead to an overdose or toxic levels of ibuprofen or adverse effects related to too much ibuprofen in the system. This is very common, especially when you have patients who are taking acetaminophen or Tylenol. So when we look at medications for this course, we're going to be classifying drugs according to their use and their mechanism of action. So if we're classifying them based on their use, we have antihypertensives. We may see more than one medication being in this type of classification, in this antihypertensive class. So We may want to break this down a little bit further. We may have beta blockers, we may have calcium channel blockers, we may have sodium channel blockers. So that is something that you're going to be having to look at when you are looking at these medications. Even though there are multiple medications that can be used for antihypertensives, they are going to be having different classes of these medications, and they work differently. They have different mechanism of action.